I mean, students, first year postgrads here, and the faculty, and the few words of introduction. Then we'll straight away go to the actual research methodology workshop with the introduction of the chief speaker. Okay, madam, please.
Yes, sir. Yes, sir. Thank you so much, Dr. Sudhir, sir. And welcome all the students. And I especially welcome our speaker, Dr. Sharma, sir, and uh, and also the accompanying speakers, Samata, Dr. Samata, Dr. Sameena, Dr. Satyajith, and Nagaraju. So we are very happy to again to conduct this program. Research methodology, though it's just a matter of two words, but it has lots of importance, and the importance is unfortunately not understood properly. So recently when we were having a meeting with the university people, the way all the professors, most of the professors and all, the way they were speaking about research methodology, it itself shows that there is hardly any understanding among the population, especially the doctor population. In any degree or any education outside the doctors, they all have lots of awareness about research methodology, which we are lacking. But fortunately, by God's grace, we have a stalwart with us, Dr. Sharma. So he's the one who has actually volunteered to teach all the doctors about the research methodology. And last year, uh, when I took few glimpses of his lectures, I understood how much we are lagging behind. Okay, now I want all our students, not me, all of us, from the management till the faculty of GEMS, we want all the postgraduates of GEMS to be well versed with what is research methodology and how are you going to get benefited out of it. Okay, that's very, very important. It's not just that it's a part of your curriculum. It's just that the force which is going to drive you and how you are going to learn, how you are going to really take up some research, how you are going to present yourself. All these things are very, very important. See, every year so many PGs are coming out with so many dissertations. Now, how many are really praiseworthy? How many are really worth being quoted in some other form? How many? There are hardly one or two out of all. Now, you should be the best people to do that. You should be the best people to really understand what is research methodology and uh, present your dissertation not just like a part of your curriculum, but something with your whole heart, with your zeal for learning, and with your zeal for research. All these things. Now, I'm very sure that the faculty we have under the leadership of Dr. Sharma, you will be doing your best. I can promise you that. Only thing is, what you all need is more of commitment, more of sincerity, right? And more of discipline. I find people just walking in even now. When he was ready by 9:45, what is the problem? You all have to come by at least 10 o'clock. Why are you all so late? And once in a while I get messages, I'll be online. Why? What is the problem you all have? So please be more sincere, more committed. The very sense of organizing all these things is not just to finish away the curriculum and show to the university we have done something. It's only to make you all understand more about everything and make you all really perfect doctors. That's what we all want. So the products that come out of GEMS should be really worthy products, not just some doctor coming out with a degree in hand. We don't want that. Okay, so please take it very serious, and we are very lucky to have Dr. Sharma with us, and the accompanying faculty, Dr. Sudhi sir, Dr. Samata, Sameena, Nagarjuna, and Dr. Satyajit. Welcome you all for this wonderful program, and I request Dr. Sudhi sir to introduce Dr. Sharma. Hope I'm audible till now. I'm just going on.
Madam,
Sir,
we're very happy that we did not miss you. Your physically was not here. You are among us.
I'm glad, sir. Till now, I had a problem with my audio. Suddenly, it started working. I'm very glad for that. Please introduce Dr. Sharma, sir, and maybe you can also introduce
Yeah, all our other people.
our accompanying faculty. Sharma, sir, welcome from my side.
Our present session is research methodology session. Now it will be conducted by all very recognized, well eminent faculty, and out of which Dr. Rachakonda, Dr. Sharma, VSN Rachakonda, and he is the chief faculty. He is going to take the lead in conducting this session.
Sir, Jem's mic is muted, sir. Jem's mic is muted. Please unmute the mic. Jem's Srikakulam mic is muted. Please unmute. Jem's
Is it audible, sir? Is it audible now?
Now audible, sir. Please,
Okay.
all others, please put off your mics. Please mute your mics, all others, please. Then only we will be able to hear Dr. Sudhir.
Okay. Sharma has been with us for the last 4 years, and he is very actively involved in the teaching of the medical postgraduates and undergraduates. And we are very much privileged to have such a faculty, eminent faculty, very knowledgeable faculty. And it gives me a pleasure to introduce him. Dr. Sharma VSN Rachakonda. He is a student from Andhra Medical College. When I joined Andhra Medical College, he came out of Andhra Medical College as the best outgoing student in the undergraduate course. That is in 1974. He has done his MD, and later he has taken his MSc from Canada, and he is the fellow of College of Physicians from USA, American College of Physicians, USA, and he is FRCP from Glasgow, FRCP from Edinburgh, and he is a fellow of Indian College of Physicians, and he has been very actively involved in the teaching in the various institutions in the country. And he was the Emeritus Professor of Cardiology in Rajiv Gandhi Institute of Medical Sciences, and he was the Visiting Professor of Medicine for our college, and he is Adjunct Professor from Tamil Nadu, Dr. MGR Medical University, Chennai. He was the former Secretary, American College of Physicians, Indian Chapter. He was a Senior Consultant Physician in the Manipal Hospitals, and Honorary National Professor of Medicine, IMA, CCB. He is Adjunct Faculty of the JS Medical College, University, Mysore, and he is the MRCP Faculty for Takshila American University. Now he has been teaching these students continuously. He was very much actively involved. He is very much interested in the propagating the knowledge and transmitting the knowledge, whatever he gained, and to the next generation of students. That makes him to travel throughout the South India and wherever is needed in India. And he is also very spiritualistic man. He conducts very spiritualistic courses, and he has got a lot of command over our epics of our Hindu culture, and he conducts very regular sessions on that. He is a holistic individual. He is a holistic gentleman who helps us always, and he is always at the rescue of gems. And now he is more volunteer to conduct this research methodology. And along with him, we have very dedicated faculty of our own college. Dr. Satyajith Pattnaik, Professor of Community Medicine, and Dr. Sameena, Associate Professor from the SPM Community Medicine, Dr. Samata, Professor of Microbiology, and Mr. Nagaraju, Research Coordinator in our department, and statistician. Murali, our statistician from Community Medicine. All are will be actively involved in the conducting this program. There will be some exercises where our resource faculty will help you in getting things done. And without losing much time, I think I'll hand over the mic to Dr. Sharma to commence the program and continue it, sir. Sir, Dr. Sharma.
Thank you very much, Dr. Sudhir Garu, for a very warm welcome and also very sort of detailed introduction, and that shows your affection towards me. And the only thing that all of us require to know is the commitment to whatever we do. And we have that in plenty in all of us. So let us see that this workshop is going to be a very fruitful one for all of us, including the students, postgraduates, and of course, the accompanying faculty also will be helping me to go through the things. The model in which we wanted to conduct the workshop is something like not one-to-one direct knowledge or one-way traffic. I will be presenting a concept for about 20 minutes or half an hour, on which you and all of you please mute your mic. Request to all of you, we will not be able to hear anything unless the mic. Komala. Please mute, except Jem's mic and my mic. Everything else will be muted, and videos also will be muted. To be an online platform, this is a very important for all of us to see that nobody is disturbed, including the speaker. So having said that, this workshop will go in for 6 days, each day between 10 o'clock to 12 o'clock, as has been emphasized by Principal Madam. All of us have to be very punctual, and before 10 itself, we have to be here. Sharp on 10, we will be starting the workshop. So the methodology will be, there will be a sort of one-way traffic content presentation for about 20 minutes to half an hour, following which you will be given a worksheet. So you will have to understand what is presented and then answer the worksheet. Of course, our faculty there in the hall, they will be helping you to sort out those answers. Once the 20 minutes of your answer time is over, we'll again come back and discuss your answers and go to the next topic. This is the way. Today we propose to hold 2 topics today. That is, I'll show you that.
I'll request all the students who are sitting in the last benches come and occupy the front benches. They are kept vacant. Please. See, you are not undergraduate students. You run away from this reality. Please be bold and face it. Come on, come on.
And no 2 students in one bench.
Only one bench, one student. Come here. All the front benches are vacant. Only one student, one bench. One student in one bench. Come on, occupy all the front bench. We are not going to do any harm to you.
Can you please see this? Are you able to see my screen?
Yes.
Are you able to see, sir?
Yes, sir.
Yeah.
It is visible. It is visible.
So somebody please say yes, so that then only I know that you are able to see what I am showing.
Okay, okay.
Fine. Research question and research study designs will be today's agenda, and protocol, proforma, and questionnaire will be for the third, including sample size and sampling. Studies on disease causation will be on 4th, and diagnostic testing will be on the 5th. Measurement in medical research will be on the 6th, including the test of statistical significance. And finally, whatever is left out, scientific paper writing, wrap up your doubts, we will keep it for the last day. This is the way. Yesterday we had a small planning meeting with my co-faculty, and this is the way we have decided. And we will be doing this way. We will start with the research question. So I'll share the research question presentation now. So can you see my screen?
Yes, sir. Yes, sir. It is visible.
Now, supposing at any point of time I'm not audible or visible or screen is not visible, kindly alert me. Then I will try to fix it up here from my software. So several people are still trying to enter. I may not be able to honor them. I will see if my attention goes there. I will click admit. Otherwise, they will be waiting. That's all. So, okay. Now, why many of us are not doing research? Can you just tell me? You write in your paper, all postgraduates, why you do not like to do research, or why you would like to do research. Either way. Most of the doctors are either not doing research or not interested in research or not able to follow research. This is only happening in our country. In other countries, every doctor, every consultant, every senior teacher is a researcher, and they publish a lot. Again, still some mics are open, sir. A little bit of noise distracts me. Kindly, sir, all of you, I'm praying with folded hands. Please close your mics and videos. Let us go ahead with what we wanted to say. If you are keeping your mics and answering questions or entering now, it will totally distract what we are trying to do. Kindly cooperate and understand. Now, the point is sometimes research takes a backseat in our country because we are more preoccupied with the academic excellence and teaching and clinical care and also administration, some of us are. But research is the backbone of development. Unless one documents what is being seen, how do I know, how do the world know that things are going this way in this part of the world? So always it need not be an original work like what Einstein has produced. It can all the same. It can be a sort of replication of the work done elsewhere in our setting also will be highly useful. This will help us to generalize the findings. Having said that, there are a few things that you need to know about the research question, and that we will be now looking at. So for those of you who do not have my contact details, these are the contact details. I wanted to share these things with you because this is an ongoing experience and this workshop is only for 6 days. But I am at your service and use me for the postgraduate course during which you are in GEMS or elsewhere. Whenever you are, you can always write to me or put a WhatsApp message. And my website, of course, is also available here. And we have a teaching YouTube channel also, where several medical content and research content is also projected there on the YouTube. So I request you all to use these things and then take note of the details. And of course, the presentations will be shared to Dr. Sudhir Garu, who will be in turn posting to all the postgraduates, or Dr. Sajith also can do that. Now, the agenda in the research in general goes question, study design, sample size, measurements, reliability, alpha, beta error, test of significance, analysis. So this is all, I have shown you this is a structured agenda generally, but I have shown you what I have tailored for our group in the next 6 days. So now we are going to look at what is called the question. What is question? Why do you call question? So in scientific parlance, any research idea is called a question. So question means not, what is posed by the teacher to the student and the teacher says, cuts a sorry figure or answers the question. That is not what we are asking. Research question, the question or the research question. First of all, any question you take up should be researchable. If it is not researchable, then there is no point in having the question. So first, that is the fundamental requirement, and you must have enough interest in the question to research it. There may be a good research question, but we may not be interested in it. Third thing is it should be applicable to your practice, to your settings, to your community, to your area. That is another important. These are certain aspects related to a question. So let me just tell you what is a question in detail. So why we do not do research? Because I am too busy. So I have to see 50 patients, outpatient, where is the time? I come home at 9:30, 10 o'clock after the practice. I don't have any time to do busy OPD, workload, 60 to 70 patients daily. That is generally with the clinicians, most of them are busy. Or hardly have time for life's other activities. So you ask my wife, she will tell how much time I am sparing to her and the family, and that could be another answer. There is no research ethos in my institution. Nobody is publishing, nobody is doing research in my community. Why should I be really bothered about that? No, the trend has to change. If you don't do research and publish, in today's world is publish or perish. Publish or perish. So everywhere, wherever you want to ascend the ladder, even Government of India and there are several medical institutions, MCI or no, MCI is not there, National Medical Council, all of them insist for teaching jobs and professorial posts, how many papers you have published and which are those papers. In how many of them you are the first author. This has to be done, and for that sake we have to conduct research. And research is seldom discussed in my institution. Nobody talks about research methodology, research questions. That's what Madam is telling just now. And we need to change the trend. And also, this should be an integral part. If you have 100 points of work, maybe around 50, 60 you designate for clinical care, another 25-30% for the teaching, and rest of it 20% for the research. So that may be around one-fourth to one-fourth and half for clinical and research, and also for the teaching, or teaching may take a little higher precedence, 30-20. So that would be a right balance in my view. My colleges are good doctors, but lost as me with respect to research. That is true. Unless somebody teaches me, how do I learn it? So that is the reason for this workshop. We have no cutting edge facilities in our hospital. This is a poor understanding, because you don't require a very cutting edge sort of scans or MRIs or even the PET scans or genetic laboratory or molecular biology to publish research. Even basic scientific research of basic nature can also be published, particularly the paraclinical departments like microbiology, bacteriology, and then the biochemistry and community medicine, of course, is a clinical department. And all these people can also contribute to the advancement of clinical research. Today, there is what is called clinical research methodology. It is not simply called medical research, it is called clinical. There is nothing non-clinical in the research at all. So it's only the question of how you extend it to the clinical setting. I do not even want to talk of ethics. Sometimes what is happening is, whenever we are asked to write a dissertation or a paper or something, we go to the internet, search the title, find about 10 papers, and select a few of them which we like without even knowing which is good or bad, and try and cut, copy, and paste, and even not even acknowledge the person. In one conference where I attended in Delhi, it was a conference on hypertension, and I was sitting in the gallery. I'm not the presenter. A professor from Nagpur has come and presented a topic on hypertension. Except the first slide in which his name is there, everything else is the presentation stolen from the website. He didn't even acknowledge that he has taken. This is called plagiarism. We should always avoid at all costs. Of course, read others' research, use certain of the concepts, diagrams, pictures, but at the same time, keep acknowledging from where you have got. The source should be always written. If it is not created by you, that slide, that has to be written at the bottom as an annotation for people to know. And sometimes you may need an explicit permission from them to use their diagrams or pictures or content. If that is the case, then you have to write and get it before you even put it up for the presentation. But of course, for teaching purposes, nobody objects. Supposing I want to take a diagram and explain you about COVID pathogenesis, there won't be any objection, because this is only a learning opportunity. Now, even then, we will be acknowledging from which source we have taken. These are some of the ethics related to research. How do I do research? Why, how, and what? Why I should do research? We have now discussed how I should go about this workshop. What you wanted to research, it is your choice. So this is, the journey is like two parallel lines. I have to keep thinking that ahead of time and go along with the other line, then only it will go. If we say we know everything, the lines meet, the journey ends, and we will never be able to really go forward. So now, research methodology, biostatistics, medical writing, evidence-based medicine, these are all well linked. We have moved from a situation of, we were earlier treating disease, from disease-centric to have come to the health-centric, and from health-centric, we came to the patient-centric, and from the patient-centric, we have come to an individualized care. That is what is called, to tailor the treatment for each individual according to his needs. And this is what is called the EBM today, or evidence-based medicine. No intervention is allowed or worth using without there being a proper evaluation and evidence base for that. However simple or complex it may look like. For example, this COVID pandemic is going on. Everyone of us can try whatever we like, and then we may not know what will be the end result, and we may jeopardize the community. So we have to go by the evidence base. So now the other thing is, a systematic scientific study is what is research question to increase the knowledge. The reasonable hypothesis should be reasonable, focused and specific to a clearly defined, have a reliable measurement tool for that quantity. That means you want to do something and there must be a lab or a clinical method to measure that, and should aim to address the gap in the knowledge. Suppose you do not know what is happening in our country about that particular disease, there is a gap, and whatever you do will be definitely used. Avoid usually duplication of established knowledge. For example, amlodipine works in hypertension, we all know. We don't want to do a research paper on amlodipine and hypertension because this has been a beaten track for the last 15 years we have been using and we know it. Versus a new drug comes, I would like to assess that new drug versus amlodipine. It's most welcoming. That could have been tried in other institution, but we all jolly well, we can also try and see our experience also. Most important, ethics and feasibility, resources, personnel, cost effectiveness have to be worked out and backed by good review of literature. A real student is one, a real researcher is one who just go through the subject review of literature for at least 2 to 3 months on the topic he wanted to do. If you want to do a dissertation, right from day one, don't think about collecting the data. Go and dig what is available in that particular topic and then understand the state-of-the-art knowledge, and then whatever you wanted to use in that or graft on that, you can definitely do that. So this is to say that review of literature goes without saying the primary requisite for doing any research study or even dissertation for that matter. For example, I wanted to know the impact of diabetes on fatty liver. First of all, I must know about diabetes and fatty liver thoroughly from the literature, and then probably get into my research question. So research question obviously demands all of the above. What are they? First, the hypothesis should be reasonably be tested. It should be focused and specific, and there must be a measurement tool, reliable tool to measure it, and it should be somewhat novel, at least in our area. Avoid usually duplication of established knowledge, and then it should be ethical, feasible, and cost effective, and backed by good review of literature. This is the fundamental of research, and of course, relevant with reference to local and national needs. That is very, very rare. Every time we do anything, that it should be relevant to our local and national needs. Supposing I wanted to do research on African sleeping sickness, that is not available here. I want to do on Totsugamushi fever. Why do I do that? Versus I do something which is so common in our setting in my country. So that is the basis of research question. You understand that these are the basic fundamentals of a research question. Then this can be all resolved into 5 different things called FINER. FINER. There are 5 different attributes. It should be feasible, first of all. And you are here for a period of 3 years. Already 3-4 months will be spent in acclimatizing, and which should be done. Can this be done in a period of around 1 to 1.5 years, so that I will have time to write it up as a PG? Or if you're in the department, you should size it in such a way that is it feasible for the next 1 or 2 years, I should be able to research these things and that. And it must be interesting to you. Never take up any topic which is not interesting, because it is boring to do something which is not interesting. So you will go halfway through and then try and stop it, or copy and paste from somewhere and complete it and give a binding shape, put your name and your professor's name and give it. That is not expected. And it must be somewhat novel. Means I am not going to become Einstein, but at the same time I am going to do something which is novel to my community, to my area and the research area. And of course, ethical. Suppose I wanted to do a study. I want to know whether how many people will be infected by the coronavirus, either by aerosol or this. Take half of the population and expose them to deliberately to coronavirus, and another half not to coronavirus, to study it. It is just illogical and unethical. This is an extreme example where I say that unethical means which we cannot afford to do it. I want to know the impact of hepatitis B. I can't ask half of the people, you get hepatitis B, and the remaining half will be without hepatitis B. I will compare you both groups and see how many of you will develop liver cancer. Absolutely unethical. So there is always an institutional ethical committee will be there for all the institutions. A proposal has to go through the ethical committee. Of course, relevant to the local needs. Remember, F, feasible, I, interesting, N, novel, E, ethical or relevant. This is from Cummings et al. 2001 has published these are the finer thing. So whenever we use somebody else's, we have to give the annotation just like that so that we are acknowledging their help and also the contribution for science growth. So keep that sort of mnemonic finer in your mind, and then any paper you are going to read or wanted to write, I mean, start a research, use these criteria. So let us say I am putting cilnidipine is better than amlodipine. Then let us say new drug has come, cilnidipine or any other new drug for hypertension, and the question is it better than the standard drug amlodipine? The question could be written like this: is cilnidipine better than amlodipine in terms of? So what are all the things interesting? First, it should control blood pressure. Second, it should be renal protection as measured by microalbuminuria, and it should reduce the hallmark of damage of hypertension. Left ventricular hypertrophy is the most pathognomonic evidence of damage of in the organs in the body. So LVH should be brought down, and we know amlodipine produces tachycardia and pedal edema. Is the new drug better than that? So these are what are called the outcome measures. So they use the word, there are a lot of technical jargon to come. Outcome measure is a measure to evaluate the research. Here, this question is very clearly tailored. So first of all, and just think over, can I do a study of cilnidipine and amlodipine in the medical ward under the supervision of Dr. Sudhir Garu? Yes. It will be feasible because we have patients of hypertension and we have cilnidipine and amlodipine available, and it should be feasible, and the effect will not take 10 years to see. It will come in another 1 month or 2 months and be able to record. I have the lab backup for looking at the microalbuminuria, echocardiography is available, and clinically tachycardia, pedal edema and blood pressure I can measure. So it is very interesting, feasible, and it is novel because cilnidipine is a drug came in only yesterday or about 1 week, 1 month back. I would be interested to know whether it really works. And it is highly ethical because we are comparing the new drug versus a standard drug. So it is ethical, and of course it will be relevant. Like that, I gave one example. You can think of any other example also. Maybe I will give you a worksheet now, and that sort of page, one pager you read out, and then you decide whether the research question, what is the research question in that paper? Is it clearly stated? Is it researchable? Is it fine, feasible, interesting, novel, ethical, and relevant? That you have to tell me. That will be the work for now. Another 10 15 minutes. Before I complete that, I have another important aspect, what is called the protocol. What is protocol? Protocol is a document that is linked like a roadmap. Supposing you wanted to go from Srikakulam to Bangalore. So immediately you wanted to drive on the road or you want to go by train, you decide. Once you decide to drive on the road, you take the Google map and try to see where you have to stop because it's not single. All the details, you have to be doing that. That is what is called a pre-agreed, already predetermined. Protocol should not be written after the research. Like looking at the roadmap after is no use. So protocol is like a roadmap for unknown area. Supposing you are going for an unknown area, any roadmap that is for the unknown area. So we will try to look at first, and this protocol has to be written. So for your research project also, your dissertation, you have to prepare a protocol. Proto means first, the protocol means first agreed document, which if followed correctly can lead you to the destination. But if ignored, can take you round and round in the circles without reaching anywhere. So this is what we have understood about the protocol. Now, we will write a small protocol by the end of this 1 week. I'll make you write a protocol. Each one of you will prepare one protocol of your own interest, and then you will show it. So this is don't think it's forced upon. This is because we have to do in the thesis. It is not a sort of a choice there. You have to have a dissertation. The day is publish or perish. Or better reason would be to interest. Out of interest you do. Medicine is ever. Then why not be part of the change process? Great fun and exciting, and gives a sense of purpose. Maybe we have an obligation to better the understanding of the disease, and that way we'll be able to do it in a better way. If not you will not follow. You will follow your colleagues' research. And across the world, they will be doing research and will be just following. How long will be following others? Have to have our own understanding. Okay. Now, after all, we are not so intelligent and well qualified. We know intuitively what is right. Okay. Intuition is often wrong. Intuitively, you may say this works, that doesn't. Somebody says anecdotally, this has I've given to 3 patients, all 3 people have recovered with this plasma. So probably you do. That is an intuition or anecdotal experience. So bloodletting for other for disorders was practiced by George Washington. He is the president. He was treated for some disorders by letting out his blood in that particular era in 18th century. Will we do that to cure a disease? Supposing I want to cure all the cytokines from the COVID patients, should I bleed him now? So that is intuitively that appears right, but it is not correct. More recently, H. pylori is the infecting agent in the stomach, and intuitively it is waterborne disease. Unless you know tackle the waterborne infection, you are not really going to tackle the disease in total. So why bother to study research methodology? We have seen the process, ask the research questions, select the correct design. I go into the design sample size. Of course, we look in the week and the proper methods of sampling, tools for measurements. All these things will come one by one. Analyze the data, interpret statistical tests. And the questions can be of 2 types. One type of question is hypothesis generating. The other type of research is hypothesis testing. In an area which is new, you can always generate a new hypothesis by your research, and that will be researched by either you or future people. But already it is established elsewhere, you would like to repeat that here. That is called hypothesis testing. So these are 2 aspects. Any research question will have hypothesis generating or hypothesis testing as the endpoint. So flawed question, flawed methodology, statistics and wrong errors. If you see, when a scientific paper is rejected from a journal, 40% are rejected because the question is not correct, and another 40% the methodology is not correct. Proper statistics only contribute to 20%. So if the question is false and methodology is false, we are going to have a rejected paper or end up in a sort of useless time waste. Whereas the always statistics is going to make the paper better. Absolutely not. The question should be clear, the methodology should be very clear. Most important domain is the research question. Most important aspect of that, most neglected aspect is not formulating the question properly and start collecting the data. Don't know why we collected the data sometimes, and I will go into the pro forma. When I come to that, I will tell you those details. The 3 words, very important: why, attention, direction, and then challenge alternatives and new concept. Now, steps to follow: do not let it be forced upon you, and find a general area of interest like gallstones, rheumatoid arthritis, AIDS, COVID, obesity, fatty liver, diabetes, hypertension, whichever is your area of interest, and read around the topic. Wide reading. In the last 4-5 years, what has happened? First, give a wider reading, then go in-depth reading. Gaps you please identify, and then read into the topic. That is in-depth reading. First of all, what we do is we should get the breadth of the topic. In the last 5-6 years, what has happened, and then in the specific area, there is an in-depth reading we have to do. And of course, you have to have the formulate a tentative research question, and then evaluate the finer, the feasible, ethical, relevant, novel, and specific, and then write down the research question and its significance in 1 or 2 sentences. So you should be able to write that. Now I'm going to leave the thing for you.